Do you have low back pain, hip or leg pain, and have been diagnosed with sciatica or think you might have sciatica? Well, with this mini-series, we're going to address myofascial trigger points that can mimic or create sciatica. Hey guys, Keith Sparks here, and I'm glad you're tuning in for our mini-series on sciatica and sciatic type pain. So what we're going to do with this mini-series is we're going to work top down. The first area we want to talk about is the thoracic lumbar junction. It's in between the mid-back and the low back, that transition point. Commonly, myofascial trigger points in those erector muscles at that area produce pain that goes down into the SI joints, which are the bony bumps right in between your low back and your pelvis. Now, the sciatic nerve is the largest nerve in your entire body, and it comes from the union of nerve roots coming out of the low back that travel down all the way down into your leg. So anywhere along that area, you can get trigger points that can compress on the sciatic nerve, producing the sciatica, or you can get compensating myofascial trigger points that also mimic and produce sciatic type pain. So for the TL junction, you can use your foam roller, you can use a lacrosse ball, you can use your tennis ball. It doesn't matter. Whatever you have at your disposal, grab it and let's get started now. First, grab your foam roller. We're going to use it at the TL junction and then we're going to switch to the lacrosse ball here in a second. The foam roller, we want to put it right in the middle where the arch of the mid-back turns into the arch of the lower back. And from here you can rest, you can push with your feet up and down. It doesn't quite matter as long as you're getting compression and getting some relaxation out of those tissues. You can even arch your back and roll that way. It's really a personal preference. It doesn't matter about foam rolling through a neutral spine. You'll hear a lot of people talk about that. It's really whatever gets at the tissue that help you relieve your pain. Next, take your lacrosse ball, and you can do either or you can do both. It's totally up to you. The lacrosse ball, the advantage with it is you can roll also to the sides, and I'll show you that here in a second, which targets more of the quadratus lumborum and the inferior serratus posterior muscle. Same area, and now you can roll up and down like we did with the foam roller, or you can roll side to side, and it gets at those attachments for the quadratus lumborum and the serratus posterior inferior along the attachment sites for the rib cage. So give these a shot, and it's totally up to you how you want to do this, but try these whenever you're having some low back pain, really right down here around that SI area. Thanks.